standing update that will take on the bulk of the meeting. So we really appreciate everybody being here, especially as summer kicks in. And your time can be stretched even further with family obligations. So just a quick reminder of our definition for our subcommittee: practice, programs, and policies designed to prevent and reduce the incidence and prevalence of alcohol and other drug use and consequent health, behavioral health, and social problems. So that's our kind of grounding foundation, and we'll keep that in mind through all of our discussions. And I think Wes or Ashley, whoever would like to take it off with roll call, that would be great.
All right, we will run through the attendance list. Debbie, you're here. Pam Pierce, are you here?
Here. Yep.
Thank you. Frankie? Lindy Petty? Shauna?
Here.
Thank you. Alexis?
Here.
Thank you. Amy Zimmerman? Zeb Payne?
I'm here.
Louis Pimentel? Louis?
Here.
Thank you. Beth, is Dr. Beth Stormshack here?
Here.
Thank you. Darren Dale?
Present.
Thank you. Martin Lockett?
Here.
Thank you. And Jessica Jacks?
Hi, everyone. I'm here. Thanks.
All right. Did I miss anybody?
I think
Tim Lynch.
Oh,
Tim Lynch.
yes.
Okay, great. Gotcha.
And I know Caroline is excused. She's got tribal meetings that she had to attend, and she let us know.
And
Okay.
so is Amy Muhlenberg.
Yes. Thank you, Ashley. Okay, Annalise. So with Annalise and Wes with the director updates, please.
Thanks, Debbie. I will, for folks who don't know me, Annalise Dolph. I'm the director at the Alcohol and Drug Policy Commission. I'm going to start us off with a little news that includes your wonderful chair, Debbie. Some folks might know that we are having a transition of the chair and co-chair of the full commission. Tony Besna, who has served since before I came on as chair, is rotating off. Debbie has been our vice chair for the past 2 years, and we put this plan together that was going to allow Debbie to just focus on prevention and move forward a recommendation to have Commissioner Kelly Minty, who is a Klamath County Commissioner, Service Chair, and Sharon Dorsey Martin, who I'm sure many of you know, who is principal at Harmony Academy Recovery School as vice chair. And unfortunately, Kelly Minty is going to be stepping down at the end of the year. Her term as county commissioner, unfortunately, is going to end. So we reconvened in June and recommended that Debbie serve as chair of the full commission. So for at least the next 2 years, we'll have Debbie as chair and Sharon Dorsey Martin as vice chair, pending approval from the governor, which we are anticipating soon. So congratulations to Debbie. Thank you very much for stepping up, but wanted folks to know that Debbie is doing a little bit of double duty, but she is ready for it, and the transition is upon us. So just want to make sure everybody knew that. We also just had some reappointments and a new member who is coming on the full commission. Our attorney position is turning over. So Frankie Hupy, who has served on this committee has concluded their time with the commission after 8 years, actually. So Frankie was our longest serving member. And probably for over the next couple of months for Caroline to share, but Caroline Cruz is also going to be moving on from a very long tenure, also 8 years with the commission. And we're in the process of appointing a new tribal member. So a little bit of movement at the full commission. The full commission met in June at Miracles Club in Portland, which was a really fun, great experience. And there were pictures in the last newsletter and a profile of Julia Mines, if you missed that. But we really focused on kind of talking about measures, moving forward, using a couple of examples from work in the committees right now. In July, on July 13th, the commission will meet again, and we're really going to focus on our Q2 update, which will really focus on the progress we've made in the plan over the past 6 months. So if you're curious about what's happening in the other committees as well as yours, please tune into that. And then the commission's taking August off, which is very exciting for us. Some committees are taking some time off, but not you all. And then we'll be back in September to do a deep dive on the state agency financial analysis that we've been doing, which dovetails nicely with the House Bill 3321 primary prevention deep dive. So that is kind of big picture updates. Health and safety interventions meets next week. They have kind of a shift for a couple of months. They're meeting the last Tuesday of the month, in case any of you thought they were meeting this week. They will be largely wrapping up their conversations about naloxone to get ready to do some model policies for expired naloxone, some continued work on that, as well as a toolkit related to accessing naloxone so we can overcome those last barriers before they turn to some other work later in the year. The recovery committee developed the core definition of recovery community centers. And met with OYA, the Oregon Youth Addiction Alliance, this month to add a section on youth centers, specific best practices if recovery centers are serving youth, which is very exciting. And they have started to discuss measures to best show the work of recovery centers that might lead to some eventual kind of surveys year over year to track what recovery centers are up to. The treatment committee identified their priorities for an upcoming treatment provider landscape survey. And in July, we'll focus on identifying improvements to discharge and transitions from treatment settings. And of course, Mitch has a couple more things in there, but I'll leave it at that. So starting to focus on some of those transitions. I'll leave it up to Wes to give an update on the next couple months for you all and for OYA. But I think that is all of my big updates for the moment. Happy to take any questions.
Any questions for Annalise? Okay, thank you, Annalise. Wes, do you have anything to tag on with that?
I just wanted to make folks aware of the two SAMHSA funding announcements that happened over the last 2 weeks. I know that caused quite a stir, so it's about $740 million. I'm going to put both links to the announcements in the chat. Just know that some of these are available to community. Oh my goodness, what is Zoom doing? I apologize. Hold on just a second. My Zoom chat is having a bit of a hard time. Just know that the timelines on these are pretty difficult for state agencies to turn around first week in June in some cases, with the legislative approvals that are needed to get approval to actually apply and then to apply mechanically. The short timeline is making it pretty hard. I will just say that all agencies that are applicable to prevention and youth treatment in particular are consulting with each other to talk about who would be best to own a federal grant should the state of Oregon apply. We're still analyzing whether it is feasible, whether adding something new is the right time to do that, or if funding could support existing programs and processes that are happening. I'm not seeing anything specific to primary prevention right now in the funding pieces that were available. There is primary prevention money, but it is available for other states and for community-based organizations around shared risk and protective factors. So Oregon as a state would not be an eligible applicant. So aside from that, we are talking with the suicide prevention team. There is some suicide prevention pieces that are in that. I think they are applying on the adult side, and I think I don't know if they have quite right now the capacity to apply on the youth side. So I just wanted to give those. Did I put both links in? Just making sure.
Yeah. And there were two, when you click on that top link that Wes said, that might be that are kind of primary prevention. We've got the Stop Truth on Preventing Underage Drinking and the Strategic Prevention Framework Partnership for Success.
Yeah, which Debbie, that one we're not eligible for since we already received that grant.
But there are the community ones.
The
and I know,
communities, right.
yes,
So yeah,
might have some people.
So
Yeah.
I understand OHA is going to mass market those to ADPEP,
Yes.
and so y'all should be seeing those in the new newsletters that you receive from OHA. Sorry about that. Yeah, that's right. But
Yeah.
the state is not eligible.
Right.
Yeah.
Okay, great. Thanks, Wes. And before we turn it over to, I was just looking through those grants too this morning. There's a lot happening in a short amount of time. But I did want to acknowledge what Annalise said as far as the chairperson position. I think it's a hats off to all of you because of the work that they see coming out of our subcommittee, that the other commissioners on the ADPC see the value of the work that we're doing. And I was hesitant initially, but when you guys voted and Luis stepped up as co-chair, I feel like that really helps so that if there's sometimes I feel like, oh, I'm doing too much primary prevention, and I need to do a little bit for everybody. I don't have to worry about that because Luis is right there and is representing us also on that. So this group as a whole, committee members and other important members of the prevention community, you guys keep showing up, and it's so much fun for me to brag every month at our big meetings about our attendance, the public input, and our committee members. So thank you for your continued service. And with that, I think we are all really been kind of chomping on the bit, and Tim's coming off screen or unmuting himself. So let's hear what we've got, Tim, with your update regarding House Bill 3321.
Sure. Thank you, Debbie. And hi, everybody. Tim Rourke with Third Horizon. A pleasure to be with you all today. As folks remember, we come back to you sort of every other month with an update on the analysis of the primary prevention field that was called for in House Bill 3321. So the last time we spoke, a couple of months ago, we talked about we were at a stage of gathering information from state agencies, both OHA and others, as well as building out and developing some surveys to go out. And you may remember my plea to all of you that the ability to capture community information is probably the most vital part of this data collection strategy, and that would really rely on your leadership and voice to make sure that we get a robust response rate. To follow on that, by way of update, we have received all of the state agencies have ported information to us. The information we got is extensive, and I want, to the extent that there are state agency partners listening in on today's meeting, I want to thank OHA and all of the other state agencies who have been unbelievably responsive, very transparent, and really with us knee to knee, sharing information back and forth, making sure that we have an opportunity to sort of cross-check and make sure we're getting anything we need, answering our questions. So we now have a very robust data set and report out from state agencies that we are now beginning the process of organizing and analyzing with our team internally. My other good news and gratitude is to all of you, because I want to update you that we launched four surveys shortly after we spoke at your meeting in April. We launched a survey for school districts, a survey for providers, a survey for college campuses that were engaging in primary prevention work, and recently a survey for the prevention workforce, so those who identify themselves professionally as working in substance use prevention. To the extent that you have sent emails, forwarded letters, made phone calls, stood up at meetings and said, please, guys, this is coming. Could you fill it out? We want to thank you, because the responses we got from a volume perspective were exactly what we needed. So I will tell you, the surveys closed last Friday. And so we received survey responses from 75 providers, 8 college campuses, 60 schools or school districts, and 100 prevention professionals throughout the state of Oregon. For us, doing these surveys as we do in a lot of different projects, those are really good numbers and give us a lot to work with. Now, I want to be clear, we've only just begun pulling down the information, cleaning it, figuring out, do we have everybody's? Is it complete? Are they duplicative? So we're doing some work to try and wrap our arms around it. But I wanted to just flag that we got the kind of response that we were hoping for from these stakeholders that will give us an incredibly robust picture to, again, augment and complement what we've heard in our data gathering from the state. So our time over the next couple of months is we're going to go quiet, and we're going to spend a lot of time poring over documents and spreadsheets and using our analytical tools to start pulling all of this information together and synthesizing it in a way that will hopefully tell the picture that HB 3321 requires. The bottom line is we have what we think we need. I want to be cognizant not to over jump or get over our skis in sharing with you what we may think about the data we have. Or what it's telling us, because that analysis work has only just begun. But I think the good news, and again, we have great gratitude to all of you for championing this, is that between the transparency and willingness to engage with us from state agencies and the responses from the community, we have a lot to go on and a lot to digest. And we feel like we're going to be able to come back with a robust report that will speak to the categories and asks that were baked into the piece of legislation. So that's our work over the summer, is to do that analysis work, to draft up a report, to develop some tools and visuals to then bring back to all of you. As Annalise said, we'll come back to you in August so that you have an opportunity to digest some of our findings and digest some of the information as we prepare the final version to go to the legislature in September. So that's our update. I wanted to be brief today, also appreciating you have a lot of really intensive conversation to have on your agenda going forward in terms of your hub work. So I wanted to defer as much time as possible to make sure that you get that conversation today. But I'm certainly open to questions if folks have them at this time.
Thank you, Tim. I think I don't know, I'll leave this first to committee members. Any questions that you have for Tim and Alvina regarding what he shared? Yes, Dr. Lynch, please.
Great, thank you. Tim, thank you so much for the information. I was so happy to hear that the feedback you received a robust feedback, as you said, and that you feel very confident with the 4 different ones that you put out. I just wanted to take a moment to share that in some of my meetings, asking the questions to a lot of my partners, have you had an opportunity to fill this out? Please make this a priority because we really need that to make the appropriate decisions as we move forward. And some of the conversations centered around the organization's not understanding about the survey, or they had hesitancy in the language that they received it. And this is more from the prevention, public health standpoint. And some behavioral health as well that have it. So I wanted to just recognize that even some said they didn't do it because they didn't really know if it was geared towards their organization. I'm so happy that you got so much feedback that you're able to pull that data back and start to remove the things that will impact that last decision making. So I just wanted to share that some of the information we were receiving was that it was difficult for individuals. They initially went in thinking it was going to be 12 to 15 minutes to do it, and it was a little bit longer because they had to pull some financials and so forth. But I think that's neither here nor there. The important part is that you got the information and we're excited about it.
Yeah, Dr.
Dr.
Lynch,
Lynch.
thank you. And and I will say we also we did get a lot of good communication back and forth from providers who raised questions. Is this right for me? How do I fill this out? Um, we I also think, while we think we have enough, I also want to recognize that what might come out of our analysis is, and what we don't know yet is who actually did we hear from and who did we not, right? And so to the extent, and because surveys like this are always voluntary, for the most part, right? There's always a margin of error because all of us collectively can do everything we can to clarify and welcome and invite people in to do it. But we may conclude this analysis and come back to you and say, look, there are particular stakeholders or particular types of organizations that we feel are underrepresented in the data. So that's going to be part of our inquiry as well, is the next step of, okay, we got from a volume perspective, we got a lot of robust response, but did we hear from the right avenues of providers? And if we didn't, does that, again, this is where state agency data becomes helpful because we can augment some missing gaps in community intelligence, et cetera. But I think an inherent challenge that we'll face, and we'll provide you some recommendations coming back as well, is that prevention is broad. The partners who might identify themselves as doing prevention work might be one cohort, but as we all well know, there are lots of organizations who are doing what we would collectively feel fits within a primary prevention definition, but they don't self-identify that way. And so how do we engage and capture them? So I think we'll have some learnings and observations from that. So I really appreciate that wisdom and your insights in hearing from community members.
And thank you for clarifying that. It's reassuring to know that you're already thinking about that gaps that may come in and how to plan for that once you receive it. So thank you again for all the work that you've done, Tim, and your organization. We really appreciate you.
Thanks.
Yeah, if I could get you just one sec, Pam. I think as I heard you talking, Tim Lynch, that I heard some similar things, and it didn't, just from my own personal perspective, I was like, yes, that is good news. Because we're starting to unpeel that onion, so to speak, and I think it also kind of showed where we have some of that siloing, and because Tim and Elvina, the team we have there working on this, we know they know what to do with a gap, and that's not just going to be something that's oh, we didn't hear from them. It stands out as, okay, how do we close that gap? So it was almost kind of, to me, because I think I saw just about every version of the survey somehow. And I really feel like there's going to be so much value. It was almost like a mini revamped community readiness assessment is how we move forward. And there's things, even no news gives us data. So, Pam.
I totally agree. And Dr. Lynch, when you said not geared to their organization, that's great information too. Because again, I'm sending it to people that I think is, doing primary prevention work, but they may not think they are. But the fact that I think they are, and they say no, it's like we almost needed to have collected that too. Because if we're out in the community and I'm thinking that XYZ organization is doing this work, and who knows, maybe they're collecting money for it, but they don't identify as doing the work, that we need to know that too.
Yeah, that's a good point.
Any other questions for Tim? If it's okay, Jessica, I'm going to read your chat here. I was happy to do the provider survey for our organization, and it did take me over 2 hours. Yes, when we had to go into each intervention, we had the opportunity to do that. And I still felt there was more to describe. I'm excited to see the results and anticipate we'll have more questions as part of the process. Yes, thank you. Anyone else? Okay, well, I'm not going to let Tim off the hook quite so easy. There were a few of us that had the chance to be part of the request for proposal process, and we had the chance to read Third Horizon's proposal as well as other ones to do this big work. And I'm kind of want to ask, whether both you, Tim and Alvina, when you guys were writing that proposal and what you maybe were dreaming of what was going to be the desired outcomes, and we're maybe partway, I don't know if we're halfway through or where we are all on that. Do you feel like this is what you initially dreamed would happen, or are there even some through this process it's like, wow, we needed to kind of revamp? How are you feeling on that first initial, hey, this is what we think is going to happen when you proposed it?
Yeah, Debbie, that's such a great question. I don't think, I think we are at a place that we expected to be at. I think one of the pieces, and this will, and it relates to Dr. Lynch, even in your comments, and this discussion that we've just had as a group. No data is data. So there are, our inquiry and our discovery and what we've seen. And again, I don't want to get over our skis and talk about results or observations yet, but a part of this analysis is looking also for gaps and limitations. And as we've gone through this part of the data gathering component, there are some limitations that have emerged. None of them are entirely surprising. But I think, we have a quest to uncover the truth and uncover absolutely everything. And there are going to be, I think, when we analyze and clean the data and look at all of the inputs we've received, there are going to be some unknowns that are not answerable in the current ecosystem. And nothing that I think is puts at risk the quality of what will be delivered to the legislature, but I think will speak to some of the known limitations and gaps that this committee has elevated over the course of the comprehensive planning process. So I don't think there's anything at this juncture that we feel like we've been surprised or had to take a dramatic pivot on. But I do think we have and are probably going to find some of the areas of limitations and challenges where there is not a clear answer. And why is it that there's not a clear answer? And what does that mean for the future of this committee's work or what you ask of the legislature going forward? And so I think that's been a learning as we've started to dive into the data and work with our state agency partners and others, is to sort of hit places where we feel like we're getting as much information as is available. And it may be indicative of some gaps in knowledge that we collectively will have to think through going forward.
Thank you, Tim.
Yeah.
Alvina, if you're able to come off, I know you were kind of the face at many of the meetings when you introduced some of these surveys. How was that process for you?
I think the process overall, Debbie has been incredibly supportive and collaborative, which is what we're the most thankful for. I can tell that some of those meetings where I had the opportunity to present, everybody was so open, and even with the questions and the feedback that we just discussed a little earlier, it tracks with what we have been expecting, what we have been learning. So I think overall, nothing that is taking us by surprise. And it's been, what I will say is that as we get deeper into the process of cleaning and organizing and really digging deep into what we have received, as Tim mentioned too, it will become a lot clearer in the direction that we're headed. But so far, with what we have and what we've learned, we feel pretty confident and on track.
Great.
And once again, just immense amount of gratitude for this committee and the work that you all have done to support us being able to push this work forward.
Thank you. Thank you. And just to kind of close that out, unless anyone has any more, appreciated the comments
Martin,
and
Martin's hands
Martin
up.
has his hand up,
yes,
Debbie.
thank you, Martin.
Thank you. So just so I'm clear, so it sounds like there's not kind of a process of like a say a phase two or an extension of this where there's if there's glaring gaps or underrepresentation this in this aggregated studies and findings, but there won't be a process to kind of specifically seek out those who are not represented in this collection of data. Is that fair to say?
If we ultimately arrive at a place where we can't get to a particular cohort or we feel there's underrepresentation, I mean, we'll do as much as we can between now and the delivery date to close that gap. It is, and again, having not reviewed everything yet, it's entirely possible that we feel like we've got everything and we've got a good cross representation, and we can say to you that we believe this is representative of the entire industry. If we can't maximize that, we would name it and then suggest some methods or approaches that the prevention committee or the ADPC may want to take going forward. Sort of in the recommendations section of the report. The other caveat is there's sort of two challenges. One is what happens if we didn't get key information from a sector or a group that we believe is critical. The other is that and I appreciate Debbie's every meeting reminder of what the definition of prevention is. We are following that definition. And that means there's going to be information we have received we're not going to include because it does not fall under that definition. And so I also named that there is also, so there's one side of this where maybe there's a gap in knowledge and can we solve for that? And if not, what's the next step? The other is we've asked for a ton of information in a very broad brush and people have sent us a lot of stuff. People are feeding in a lot of stuff. Does it count, quote unquote? I mean, because Dr. Lynch, your point, right? Some organizations feeling like, should I even respond to this? We've all said organizations and entities say, well, I do these 17 things. I'm not sure if all 17 of them fit under the definition, but I'm going to report them in anyway. So I would also name that is a piece that we're also navigating, where there may be data and findings that come to us where we say, this work is sort of on the outside of this definition. And then what does that mean? Does that mean anything to this committee? Or it doesn't, it may not show up in the final report at all because it doesn't meet the definition. And then that would be feedback we would reflect back to you all as well, again, to think about how does the committee view that circumstance if it happens? So I think that's where I think the conversation that we'll have in August will be really value add, because there will be some places where we're going to want your wisdom around gaps or some of the gray area of this work that is so common in trying to understand prevention systems, where we're going to look for your support in figuring out what some of those trade-offs are.
And I'm just going to take a couple of seconds to add something to what Tim just shared too. The framework that we're wanting to take is yes, the primary prevention definition that we've been sticking to. And really, we've received such diverse and rich data and different types of data and information that the overall framework that we want to take with this work is where is all of this evidence and data converge into telling us a story? And then where is some of these data points diverging and telling us these different storylines that emerge as side stories, right? So that's the framework that we want to take it as and give back to the committee in August.
Thank you both. Wes, I saw your hand up for a second.
That's okay.
You're just waving at me. Hi, buddy. Oh. All right. I think this is just exciting news. And just maybe something to kind of remind or re-educate this group. When the group that was really working on this legislation, there never was a money ask. But I think the people that higher up on the chain saw the value in it and saw, hey, we need more, we need. So again, your voices are being heard, and I know we're always looking for money. This was where, whether it was the legislature, whether it was our leadership at ADPC, however all that works, I don't always still understand the money trail. But I think we owe everyone that played a part in that for we could have the funds and have the expertise of Third Horizon. So this has been outstanding. So I want to move right into, because all of you have been doing some homework and have been sending in to Professor Rivers. So Wes, let's move us on to our next big item on the agenda, scoping of the Center for Excellence.
Hi, everyone. I will share my screen. Okay. So where we left it last month was that we had fully defined the pillars. And so, um, uh, 6 pillars of the Center of Excellence. I'll just go through them very quickly. We renamed them based on kind of where we wanted them to be more solid. So I'm just going to name these really quick. I'm not going to go through all the text because there's a lot and you have it. Knowledge and resource infrastructure, a centralized clearinghouse for evidence-based and community-defined practices. I think we did you all did an excellent job of really narrowing that down. I think that was the most engagement I've ever had on a homework, and it was largely in line with each other. So, I think after the conversation last month, the specifications under which that clearinghouse would operate are pretty clear. Um, the second is foundational, advanced, and leadership pathways for workforce development aligned with standardized statewide competencies and supportive state certification and national leadership accreditation pathways. Again, I think the committee took a lot of time to kind of divorce a conversation around the CPS to kind of a broader workforce approach and tiered methods of advancing yourself through both a professional lens, but also a leadership lens within communities. And so I think we got a lot of great feedback that has clear specifications. Strategic and agile response to emerging trends. So using a Han-like system, there was a kind of a clear key functionality that was built last month. There was some commentary to add a kind of a statewide opt-in communication channel. So this was additional commentary through the homework. We've added that in. Largely, it's in line with the rest of the key functions. So I just wanted to name that has been added. Translation functions. And so this is one that was changed from the original proposal that was given by Third Horizon. So you all had suggested maybe we combine that between policy, academic, and practice into one translation function that was clearer. We got some clear focus on both translation from academic research to practice, but also practice to policy feedback loops. more defined partnerships with our university systems and some of the institutes of who are deep thinkers about this. We further defined community coordination and alignment with the role of the center really bringing folks together, both in regional or local coordination clusters, also coordination across different types of counties. So large population counties, for instance, or counties who share some specific demographic representation. And then finally, we added risk and protective factor integration. So really thinking about what the center is doing with respect to upstream, building upstream prevention infrastructure that provides a lot of cross sector prevention language, shared risk and protective factors alignment, and then building efficiencies across some of the work that's happening around healthy youth development, positive youth development, environmental protection, ACEs, population level prevention. I'm going to pause there to make sure that everybody feels like they're caught up from what we did last time. Okay. I made a promise to my chairs, or y'all's chairs, that we were going to get through scope today. So we're going to really try really hard to do that, at least to get to a point where I can give you a draft for homework to review over the summer holidays, and you can come back in July and we are ready to go to governance. I just want to say this has been an incredible amount of work that you all have done, and the engagement on the homework has been super awesome. And we wouldn't be here without that. So just kudos to all of you. Please keep staying engaged. I know it's hot outside. Like there's so many other fun things to do because I know y'all are really busy during the day. So like this is the last thing you want to do is homework, which feels like homework because you're probably doing it in the late hours of the evening. I do get emails from Pam in the late hours of evening, so I know that's when she's doing her homework. I think that it's really important that we are so close to a really good idea. And so I think if we're crystallizing that and we're going to be rock and roll when HB 3321's analysis is put out. So I appreciate you all. I thank you for sticking with me as we kind of put this together in these homework assignments. So the first homework question was on primary prevention as defined in HB 3321. Does this definition set the boundaries on scope? How does the COE make connections to other parts of the continuum of care? How does the COE reinforce substance use prevention without drifting into adjacent domains? So this question was really around, okay, we don't want scope creep. That's the last thing we want. We do not want to get the center spread thin for fear that it could happen like a lot of other things that have happened in the state where you establish a program and then it kind of dissipates over time because it starts getting into too many buckets of work. Overall, this was early on. Great comment by ODE that there's a need to have this discussion because if you're doing primary prevention in schools, it's very easy to identify youth with tier 2 and tier 3 needs. Those conversations naturally occur. And so we have to have some sort of process to define for the center where its expertise ends and where others begin. So I think what we got from this commentary, and I'll just go through a couple of these, is that Pillar 6 of the scope defines a vision for boundaries. So if you add the definition of primary prevention of substance use that we have statutorily with this shared risk and protective factors pillar as more defined, do we have what we need? And largely, I think the responses to this homework question align that yes. And it would be really, really important for the COE to be able to establish clear guardrails in a process when it is identifying questions for technical assistance, that they have a process to identify what the need really is and to be able to pivot to systems partners for other parts of the continuum of care. So I thought this comment in particular was really great. So just add it all together. The COE should establish clear operational guardrails to help communities distinguish among prevention, intervention, treatment, and recovery services. This includes clear definitions of universal, selective, and indicated prevention, guidance for determining when activities move beyond prevention into intervention or treatment, decision-making tools for funding, implementation, and workforce alignment, prevention first infrastructure standards, referral and coordination pathways that connect prevention systems to intervention, treatment, and recovery systems without expanding the COE's primary prevention scope. And then just the end of this is the purpose of these guardrails is to ensure this prevention infrastructure remains focused on reducing risk factors, strengthening protective factors, and preventing progression to more intensive levels of care. So, in summary, if you had Pillar 6, which is really establishing all of the clearinghouse and TA and risk and protective factors framework, plus clear definitions of support, universal, selective, and indicated primary prevention, plus a clear protocol and operational guidelines to support community to other pieces of the continuum of care. In total, that would establish a really strong boundary between what is the center's purpose and the rest of the system of care. What do folks think about that? And do folks have questions or comments about this section so we can make edits as necessary?
I don't have a question, just a comment. Wes, I do like the clear protocols and operational guidelines to support community because, the Center of Excellence is a first for primary prevention. And if folks don't know where to go, they might just reach out and feel like, again, they're siloed and don't have the right supports. But if we have a coordinated pathway to guide them into the treatment, recovery, or other sectors, it really supports them as well, so they don't feel so isolated and siloed. I that's the piece that really sticks out to me and feels supportive in the continuum of care.
Thanks, Luis. Other comments about this area?
I think this is what we're saying, but what I like about it is I think the center would provide support to communities to train and support the uptake of evidence-based practices in these various community centers. However that's defined, I'm defining that broadly, like schools, community health, maybe other organizations, and so then potentially the center would be staffed with people who had expertise in those evidence-based practices, or at least the ability to guide people to the appropriate place for them to get training and support around uptake of those. That's how I'm understanding this, and I think that's great, and I just wanted to kind of clarify.
That's right, Beth.
Yeah.
And I think, right, if you have someone who's well trained to this point of like being able to navigate to like understanding evidence-based practice, navigating towards like, we're not the experts in evidence-based treatment. So I know someone who understands CBT. I'm going to shift you to that person.
Right.
Yeah.
Well, I mean, I guess that's a secondary point. Obviously, it's not going to be the center won't have the experts of every single thing in it.
Yeah.
There should be some though, I think, but then there should be, the ability for people in the center to direct people to the right places and kind of manage that. So, yeah.
Great. And we're going to just keep it right now to just committee members, and we'll get other people as we can. So hang tight. Dr. Lynch.
Yeah, thank you. Thank you, Wes, for putting this all together. It's very clear now that you've kept guardrails from we're talking about a population that everybody doesn't fit into one section or the other, right? There, we all know helping our community that there are individuals that fall in between or that may cover two different sections or a population that may cover two. And I think the clear definition allows us to still help the individuals and the community members that fall between these definitions. And I agree with Beth on having these specialists that are in prevention, that are doing the treatment part of that specialty, the recovery system specialty to help lead individuals and communities that need resources. And that's what this center is to do, is to make sure we're covering all of our population, and anybody that may fit between those cracks of pillars, we're still able to capture them. And I think your outline and framework really shows that we're still going to be able to capture everybody. So thank you.
Thanks, Tim.
Anyone else before I open this part up to see if we have any of our community members? Any specific voting committee members? Okay, Mary, if you're still there, did you want to share something, some thoughts that you had on it?
I really, really like it. As somebody who's worked in education for a long, long time, I think it's really easy. Schools are always overwhelmed, and it's really easy for them to start asking staff to work outside their scope of expertise. And that may be because they don't have anybody else in the building to do it. And when I think about being able to refer youth to a higher level of care, I wonder, I had heard at one point there was going to be a clearinghouse of youth treatment programs statewide. I think keeping that current and readily accessible so that prevention specialists don't have to be the expert on all the treatment programs. They just have to know where to look to help youth and families get connected.
Yeah, thanks, Mary. So for folks who are not familiar, the System of Care Advisory Council has republished the Youth Resource Map, which is a centralized database of youth providers, particularly in mental health. Shout out to Katie Clemo. She is working to update that with substance use providers as well and recovery resources. And so that should be a really big resource for the state in a couple of months in our world. So shout out to all the people who are working on that.
Yes, I completely agree. And I think one thing too, there's a word, Mary, that you used, referral, and that word means so many different things depending, if it's something to do on a medical or clinic or claims basis. It's like, oh, that's a whole different thing, as opposed to where, I think we'll need to, once we kind of get this framework put together and we're excited about that part of the finished product, there will need to be some additional work on how do you brand it? How do you market it? How do you get people to see, hey, this is here? So we'll need you all on board too, to be able to come from your different sectors and to be able to see, this is the language that should be used so people see, it's kind of like they come for what they want, but they're going to leave with what they need and how we can frame that. So Pam, please.
Maybe there's a way as it's being built that, like, for example, the school systems have very specific words and that they use. And maybe, that is like a smaller work group that says, hey, we as the school systems, we use these words like referral, so that when people are looking to try to use the Center of Excellence, I don't know, and this is just an example, that when a school system says referral, this child is getting referred, that moves into intervention and treatment. So like go after the ones that are obvious. Maybe the healthcare system also has very specific words that we need to understand so that we can kind of create or set up the center of excellence to accommodate those.
Yeah, and I think as the center is a tool, we also have to remember some of our state agency staff who might be able to support that translation. So like Alana, for instance, could help us with specific pieces around how do we translate a request coming in from a school about what they really need from the center. So I see a big relationship between the agencies and the center as well.
And just imagine, we think of our CCO models and if that could be something too, when they're looking at their incentive, the payments or grants that they get to give out for when they've earned those, and be able to say, hey, here too, let's keep moving our emphasis on upstream. So I could just see where so many organizations, funders, or anything could look at this when we finally get it done and be able to see, hey, this is the foundation to an education model of how we do move things upstream. So I think there's going to be a lot of beauty in that too, as opposed to, hey, it's not a stagnant resource website type thing. This is a ongoing effort, and all of you guys played such an important role. Anything else, Wes, on specific this, or do I have any other members of the public? We want to make sure you have a chance, and it might be such that, hey, I want to read through what Wes has presented and get feedback later, but want to make sure that that time is open right now. Lee, please. And
I may have
thanks for speaking up.
I may have missed this, and excuse me if I have, but I remember months ago when we were talking, we also saw this center as a place that schools or community organizations could turn to if they felt like they needed help, like experts could go there and help them set up or teach or something like that. Is that also written in there? I haven't read the whole draft.
Yeah, in the TA function, that is definitely
Okay.
part of what we would be talking about,
Okay.
whether that's directly or through Alana or some other school-based support, like thinking about how we would deploy people regionally to support individuals.
Wonderful.
Yeah.
Thanks. And otherwise, it seems excellent. Thank you for doing it all.
Thanks, Lee. Want to kind of maybe just call out a couple comments in the chat. It sounded like Lori Sierras, I hope I'm saying that right. Apologize if not. That you're already seeing some, things that you're experiencing right now where this could be helpful. So that's awesome. Alana, you knew I was going to call you pretty soon, so way to step up.
I try to just get ahead of it, Debbie. I love this conversation. Y'all have named, the things that come to mind. Mary, thank you for calling out, the parts of schools where they get pushed outside of their scope. And it's really important to be mindful of what schools are and are not. One thing I also wanted to name, I think to Dr. Lynch's point, is as much as there's humans that exist in that spectrum of tiers, there's interventions that fall on that spectrum of tiers too. And I think about like alternative to exclusion and restorative justice in schools. That's a tier 2, tier 3 for those kids. And it reduces overall use of substances and mental health disorders among the whole population. So it can be both. And I think it's up to this group to decide where your boundaries are. And you've got a real opportunity in how you market it to think about ensuring that schools and recipients can view something as maybe it's outside the scope of the Center of Excellence and it's still an important part of prevention. And how do we think about the whole system and the boundaries of this at the same time? But I love it. It's awesome.
Thank you, Alana. And I could envision this being, as you're working with school districts across the state for them to be able to put in their prevention plans, that once this is set up that, hey, here's some additional to learn and stuff. So it's great that we have people from some of our state organizations being able to provide feedback to help us make sure it sticks. So we really appreciate that. We'll go Jessica and then we'll go Jill.
You missed Martin.
Martin, you blend in with your little picture frame back there. Okay, sorry. I'm going to go Martin, then Jessica, then Jill.
No worries. And so we don't have to flesh this out. If this falls into the staffing portion, once we get there, just let me know at the outset as I frame this question. If it's a staffing question, we can table it. But my sort of, little bit of a concern is that, I know someone had mentioned earlier that we would want these folks. It'd be great to have folks with, a pretty vast amount of knowledge and expertise around prevention and treatment and different modalities so they can really, have a full, or expertise around different areas of the continuum of care, which I think is great. I also think there could be a pitfall there in that if, for instance, some of these people were deployed to say a school or whatever to train staff or what have you, and then they start asking questions that delve into that other realm of expertise like treatment modalities. Well, if a student is doing this, well, what should we do? And oh, let me teach you this technique because this is really, really helpful. And so I just think and this might be a staffing, like once we talk about staffing and what does that look like, and what do we want the credentials to be and things like that. I just think that could be, those lines could get a little blurred because they're naturally leaning into their expertise because they feel like, oh, I can help the staff here. They're asking about, this problem that keeps coming up with these students, and I can give them some quick, techniques, MI or whatever the case. And so that kind of gets outside of the scope, I think, a little bit. So I don't know, just something to be cognizant of, especially when we talk about staffing, I think.
Yeah, I think that's a really good point of like how you do intake of TA. So like when you have your initial consultation and you really get at what the question is from the school district I think I can't remember who wrote this commentary, but like having that clear operational protocol, because I think, at a state level, when we get TA requests, I sit down first and be like, exactly what do you want? So I know, because I'm not the expert at anything, I want to make sure I bring the right people to you. And so like I think similarly we have to have an intake process that is like clear. And I think that these guidelines can help to shape that. But I'm going to note your concern, Martin, just to make sure that we double down on that.
Yes, thanks, Martin. Jessica.
Thanks. I just wanted to underscore what I was hearing from Alana and in the conversation around primary prevention and it being, this kind of the guardrails around it. And I wanted just to echo that when we do primary prevention, there is no time that we are not simultaneously speaking to resources for reduction. And so we have to be able to um, be able to refer. We have to be a part of that system. So I want to encourage an and in there into the, it is primary prevention, and we have a responsibility that if there is no resource, if there is no referral pathway, that I feel we have a responsibility to either stop, we have to rethink what we're doing, or we might have to back up and make sure that there is an appropriate pathway to get individuals resources that they do need. So I just wanted to make sure we have the and in there as part of the continuum of care. So I don't want to imply that as preventionists that we are then doing the treatment side, but if we can be part of the solution toward finding a referral pathway. And so an example of that is our Upshift program in Deschutes County. We have done some work around alternatives to out of school suspension to ensure, gosh, was this experimentation that a student was engaged with, or is there a treatment need? And so we did some work around revising that policy, but we had to make sure that there was a pathway to get those students the help that they needed. So we've done a lot of work there. So yes, so it's just an example, I guess, of kind of a combination of some prevention scope and that referral to deeper care.
Thanks, Jessica. And one thing I would say on this, I think that's the beauty too of what we're building is using, risk and protective language as well as the prevention definitions, which include universal, selective, and indicated. And some of the youth that you might be mentioning might fit in that selective and indicated. But then we really know when, and again, I think this is the beauty of being a part of the ADPC and the other subcommittees, that we're reporting back on this work. And I think they'll be able to see, hey, where do we fit into that? So some of that, I don't think we are working in a silo. And I know this wasn't you were mentioning, but I think this is just the beauty of having Wes and Annalise and our other ADPC staff here, that they see, and it's like, hey, even within that work, we're now much more connected, and it's going to be much more evident. It's like, oh, this is when we've got to make sure that this, I like to say, to referral, maybe recruitment to a higher level of help. But I think we've got some wiggle room that we might need to educate our prevention workforce that, that's prevention is universal, selective, and indicated. So helping them understand that part too. So I think that's a good call out. Both you and Martin have put with that. Jill, please.
Hi guys, I'm not ready to go through security, so I'll be really, really quick, but absolutely love Jessica's comment and Alana's as well. I'm a pediatrician working in upstream prevention, and a number of schools that I've worked with do not have a restorative program. Everything is very punitive, takes them suspends them out of school, puts them back into their risk factors that are all at home, and removes all of their safety net protective factors. So I 100% love that there's so much upstream work in this document, and would support using programs like Jessica's statewide, because she's done the hard work, and we just need to make it really readily accessible to schools. Thank you so much for all the great work, you guys.
Thank you, Jill. Okay, sorry, Wes, I got excited and forgot about we had other questions.
No, it's okay. We have one that I think is broadly agreed upon. So I think we can get through this pretty fast. The role. So is the COE a vision setting entity, a coordination backbone, and an implementation driver, or some combination? Y'all answered this question over the last 2 months. It's some combination of the three of these things. And so I think one comment put it very succinctly. All three. The COE serves as a North Star that maintains fidelity to prevention science and the intent of HB 3321. A coordination backbone that aligns systems and partners, so kind of playing that matchmaker. An implementation support entity that helps communities apply prevention effectively, and a learning and innovation hub that continuously advances the field of prevention in Oregon. And so I think by identifying practices and identifying the way in which you're going about looking at evidence-based, community-based, and evidence-informed practice in communities and where it's working in Oregon, you are automatically setting kind of a vision in that you are promoting things that work. And so I think wrapped up in all of that, it really does play a role across those three buckets.
As you listen to that and read a little bit, if there's any comments, questions, and again, Jessica, go ahead.
Thanks. I'll say this here, but I feel like my comment is maybe more global. I just want to, I guess, underscore the value that I have around anchoring in the local prevention expertise, and we had touched on it last meeting, and it's up in our pillar notes about the Center of Excellence, really thinking about their support where maybe prevention system is more robust locally and maybe not as robust. But I still, even in those spaces where the local prevention system might not have the strongest infrastructure, I want to make sure that the COE is still functioning to let the local prevention lead. And the reason I say that is because prevention work is done on trust and relationship building. And if the Center of Excellence, in their very good nature staff, are out working in a particular community, they will be building trust and relationship. And I don't want to unintentionally dampen the local prevention expertise that maybe is not as strong but could be. So just wanted to put that kind of that thought forward, that anything that we're doing, I want to make sure that the local prevention system is leading to the best, that we allow it to lead to the best of its ability with the support, with that backbone of the Center of Excellence, maybe. So I think there was some language that I just wanted to clarify, that the Center of Excellence still maintains that background picture versus getting out in front of any local staff for the purposes of that trust and relationship building. I don't know if that makes sense, but it's kind of a core value system that I think is important regardless of kind of the pillar area that we're talking about.
I would take that one step further and say, right, there are locals who are doing amazing work, which by virtue of platforming them on the Center of Excellence, we are empowering communities to go to them, right? What I hear from programs where they have outstanding work is that they become an ipso facto state consulting firm, and they don't want to be that, or they want to get paid to do that. And so I think there's this like happy medium where the center is really the connector of like this great, and by connecting them, they are they are empowering and leading hand in hand with that local community. So they're giving them more capacity in a lot of ways to do what we would hope is that, so let's just use Upshift as an example. We would love every community to have Upshift. And so like, but I also don't want to stress your staff out, right? Like by providing that. So I think those are things that the center could do while maintaining kind of like this quote unquote North Star. I like the idea of, in the absence of or the idea that was presented here, that in the absence of this North Star, or an absence of like commentary by the state on what's working and what's not, that we kind of fall to our own devices. But if we can uplift what is happening at a local level, because the local level is where it's happening, right? And so bringing that forward, it creates this leadership vision.
Yeah. And I just, Cindy, I appreciate your comment and wanted just to note that she's indicating that as a CBO representative, it's making her nervous because she's not hearing the word collaboration. And I wanted to just dispel that. Collaboration is entirely necessary. So no one entity can do prevention. Prevention is a collaborative process. I just want to make sure that we have the local system is being upheld, and that the COE, which I'm kind of visualizing as a external system, is helping to bolster that local system. If hopefully that helps. Happy to talk more.
You're muted, Debbie.
Thank you, Jessica. There's no wrong comments on any of this, because I think that's what we're trying to do. It's let's flesh all these things that make sure we don't have any unintentional consequences. So yes, great comments, everybody. Lindy. Lindy, did you hear me?
I did. Sorry, I had to clear my throat.
Okay, no problem.
Yeah, I kind of wanted to just reflect back what Jessica said, and in like my own words, to make sure I'm understanding. And because I think I am also wanting to like underscore and support what was shared, is that I see the COE as sort of that backbone positionality and supporting the folks in doing the prevention work in our local communities, even if perhaps there's partners right now that don't see themselves as being in prevention. That's part of like that bringing us all along. And the COE is that backbone support for us. And where I see the COE really helping in terms of a leadership role is at that higher level of systems building to ensure that all the funding and all the things and all the challenges and ODE and these different players that at this level we sometimes have challenges with at the local level to having influence or having a voice or being able to kind of uplift what we're seeing at the local level. So I really do also support this idea that we are the folks doing prevention at the local level are being uplifted as leaders in that space and leaning on their relationships and community expertise, and the COE really being that supportive hub in it kind of quietly but very importantly existing in the background.
Thanks, Lindy.
Thanks, Lindy. Yeah, Wes, looks like we're ready to go to the next question.
Great. How does the role fit with the existing TA landscape? How does COE complement and bolster work of our burgeoning prevention profession? So I'm going to hold the OCPP question because I think it also relates to how does it create more job demand. But there is a couple of comments here. So based on the scope and pillars as efficiently as possible, facilitating connection and uptake of existing information, technical assistance and training and professional development. So I think we talked about ways in which the system itself could really link to existing platforms. And so if you look in the first pillar, there's a lot of commentary on this. Rather than duplicating existing providers, the COE should serve as a navigator, connector, amplifier, and implementation support. So again, I think this goes back to kind of some of the commentary that Jess and Lindy just brought. It's like locals are leading in a specific area. They need help navigating some of these systems. The COE could help to do that. COE can strengthen coordination amongst organizations, including ORCPP, Northwest PTTC, CACA, universities. I actually like the example that Lindy just gave. It's like, local communities having a hard time with one specific state agency. How can the Center of Excellence help to kind of bridge that gap? I love that. That's amazing. And then the COE should strengthen, coordinate, and complement existing and future technical assistance providers, professional associations, research partners, and community prevention systems. One thing I did think about in the commentary about what was presented by Third Horizon is that HB 3321 is good, but it was a point in time. And right, there are going to be recommendations that come out of where we could strengthen conversations with specific populations or specific types of providers. That's the Center of Excellence y'all could charge the Center of Excellence to do that. And I think in knowing that we do not have a TA landscape necessarily that has the capacity to do those types of conversations, maybe it's something that the Center of Excellence could bring those providers together, see what you're seeing with respect to TA needs, see what come together to have more intensive community engagement. So just a note that came to my mind when we were thinking about this question, and that came up, that line of questioning came up earlier today. I'll pause.
Any comments, questions? And I know this is kind of a lot of information today. This will be sent out to everyone. And so we'd love to be able to give you that time to and provide feedback back to Wes or Luis and myself. Definitely to Wes. This is not your only time to like, oh, I didn't get my homework in time. This is to be able to continue this. So please know and public comment on any of this. Like I said before, we want to make sure that we have maybe even some people looking at it with if I use the term the devil's advocate, because we want to make sure that we're thinking about the things that could be unintentional consequences, so we get this right. Anything else on that one? And Wes, do we have one more question, or are we going to stop with that?
I will just quickly highlight creating job demand for CPS. So I think this question was raised when we were heavily concentrated on the CPS and before we kind of rescoped that pillar to incorporate all professions. But I will say there were some answers to this. Based on the scope and pillars, it should be more focused on scoping standard core of professional learning and tiers of different parts of the arc of the workforce, as opposed to creating demand for one certification. Ensure a workforce has competence in foundational tools and has opportunity to attain certification that most serves their professional goals. I want to see if I have that. So a combo question response for this and the previous question. If sustainably funded, ORCPP could be an important complementary asset to this vision as a practitioner-led professional. I'm having a hard time reading, y'all. ORCPP has the potential to provide the entrepreneurial infrastructure needed to rapidly mobilize prevention professionals, pilot new approaches, support peer learning, develop leadership, and help move ideas from planning to action. Together, prevention-focused COE with a strong ORCPP could create a balanced system that combines statewide coordination and accountability with practitioner-driven innovation and implementation. The COE could support this effort by defining prevention workforce competencies, promoting CPS pathways, identifying workforce gaps, supporting training and certification opportunities, and helping agencies, counties, schools, and community organizations understand when prevention expertise is needed. So you all have had this document for a week. I think I just want to pause here and just say, because we're running out of time, I'm going to clean this up just like we did for the last round. Y'all will have more homework to review, and this will be your only homework over the course of the next month. We'll have a couple of questions to kind of get y'all thinking about scoping, but they won't be as direct. They will be more conversational for the next one. I will clean this up and see what y'all think based on the commentary that was provided. If you have additional commentary, please, you're always welcome to share it. We will add it in, and it will be so the cadence of this is try to get this to you, a cleaned up version, within a week of the meeting, and then you have 2 or 3 weeks, depending on the month, to get homework answers in so it is incorporated into the draft that y'all see they'll see a week before the meeting. So try to turn it around really fast so you'll have all the information that I do. And that way y'all can make decisions in the next conversation.
Thank you, Wes. And I think one thing about our subcommittee that we really take a lot of pride in is if you're not on the email list and you're attending this meeting today, I think Ashley are amazing. I don't want to even call her support staff because it's bigger than all of that. Make sure that our emails are updated. If for some reason you're not getting the announcements, please put your email in the chat. We want to make sure that this is your chance too. Yes, the committee voting members do vote, but what you share is taken and it's very important and valid because you're part of building this system because members of you represent different sectors and that's what we want to hear from. So please continue to look at this. I do want to just a real quick, we talked about the ORCPP. Some of you may not be familiar with what that is. That's actually the Oregon Coalition of Prevention Professionals. They will very soon be set up to have their own nonprofit status. Right now, they are working with Oregon Coalition of Behavioral Health, I think, or Oregon Behavioral Health Coalition, OCBH. Thank you, Katie, and Ashley's going to take care of you. And Luis, way to go. He put the ORCPP link in there if you want to learn more about that. I think it's not trying to take over, but again, in the same process, it's like, how do we get some of the people that are workforce and expand that workforce definition that more people can understand what we do. And it is, you don't have to be a certified prevention specialist or anything like that, but it's enlarging that tent. And it's an organization of providers right now. But check out the website and see if there's some value in that. Want to open up to any public comment. Doesn't have to be on what we talked about today. Any information or things that you want to share out to the group for awareness. We've got just about 4 minutes. Ashley or Wes, have we had anybody sign up for public comment? I see Arnold coming off. Oh, he knew. There he was. Okay, Arnold, please. Oh, you're on mute.
There we go. Thank you, Debbie. Good morning, everyone. My name is Arnaud Simon. I am the Public Health Policy Analyst with the Oregon Liquor and Cannabis Commission, the state agency that regulates alcohol and cannabis. One thing, I really kudos to West and team and the committee for really putting more concrete shape, objectives, pragmatic steps about the Center of Excellence. I very much look forward to that process coming to fruition. I had to squint my eyes a bit. I love the fact that the partnership with fellow state agency is mentioned in the document. So that's also a very important feature. And yeah, just to clarify for colleagues who may not know me yet, a part of my job is really help community health partner understand how alcohol and cannabis are regulated in our state. So if you have questions on how that works, what happens, I'll be more than happy to arrange a call with you to, respond to any questions you may have. So I just put my email in the chat. But anyhow, kudos to the prevention subcommittee for this very important work.
Thank you so much, Arnold. And if Arnold, I know he's involved with ORCPP, helps us with our policy committee. So again, we appreciate his insight and expertise, just as we do all of you. Anything else? I'm not going to call anybody out today. So relax. Okay. I think we are in a great place. We still have a long way to go, but the hill doesn't seem so steep and the rock doesn't seem so heavy. So keep up the great work. We appreciate you spending time with us. And just so you know, you being here is important. I do go back to the other committee chairs and say, hey, do you have this many people show up to your meeting? So you're feeding my competitive side, and it is greatly appreciated. Thank you, everyone. Have a great rest of your month. Happy 4th of July. Stay safe. And we will see you in a month. Thank you.
Everyone.